Say goodbye to endless reading. We've summarized all these textbooks, so you don't have to. Hit play and save time. Mastoid antrum, large, air-containing space in the upper part of the mastoid, petrous part of the temporal bone. Communicates with the attic through the adytus. Roof, formed by the tegmen antri, a continuation of the tegmen tympani, separating it from the middle cranial fossa. Antrum, well developed at birth. By adult life, it has a volume of 2 ml. Medial wall relates to the posterior SCC. Lateral wall, formed by a plate of bone, on average 1.5 centimeters thick in adults. Externally marked by the supremedial Masowan's triangle, important landmark to locate the mastoid in mastoid surgery. Located posterior-superior to the external auditory meatus. Boundaries, superiorly by the supramastoid crest, temporal line. Anteriorly by the posterior-superior margin of the external auditory meatus, spine of Henle. Posteriorly by a vertical tangent to the posterior margin of the meatus. Mastoid and its air cell system. The mastoid consists of a bony cortex with a honeycomb of air cells underneath, acting as a reservoir of air to limit pressure changes within the middle ear. The facial nerve is embedded in bone in its petrous part, but exits at the stylomastoid foramen. In infants, the mastoid process is undeveloped and the facial nerve is very superficial. The mastoid process starts to develop at the age of 1 year and completes development by the age of 2 years. The lining of the mastoid is a flattened, non-ciliated epithelium without goblet cells or mucus glands. Types of mastoid pneumatization. Depending on the development of air cells, 3 types of mastoid have been described. Well-pneumatized, cellular. Mastoid cells are well developed, and intervening septa are thin. Diploidic. Mastoid consists of marrow spaces and a few air cells. Sclerotic, acellular. No air cells or marrow spaces. Occurs in 20% of adult temporal bones. Seen in individuals with chronic ear disease. The mastoid antrum may be the only air-filled space in the mastoid, and the sigmoid sinus is often anteposed. Mastoid air cell locations. Depending on their location, mastoid air cells are divided into zygomatic cells in the root of the zygoma, tegmen cells extending into the tegmen tympani, perizinous cells overlying the sinus plate, retrofacial cells around the facial nerve, paralabyrinthine cells located above, below, and behind the labyrinth. Some pass through the arch of the superior semicircular canal and may communicate with the petrous apex. Paratubal cells around the eustachian tube. Along with hypotympanic cells, they also communicate with the petrous apex. Tip cells, quite large and lie medial and lateral to the digastric ridge in the tip of the mastoid. Marginal cells lie behind the sinus plate and may extend into the occipital bone. Squamosal cells lie in the squamous part of the temporal bone. Abscesses may form in relation to these air cells and can sometimes be located far from the mastoid region. Development of the mastoid. The mastoid develops from the squamous and petrous bones. The petrosquamous suture may persist as a bony plate, corner septum, separating superficial squamosal cells from the deep petrosal cells. Corner septum is surgically important as it may cause difficulty in locating the antrum and deeper cells, potentially leading to incomplete removal of disease during mastoidectomy. The mastoid antrum cannot be reached unless corner septum has been removed. Posterior to the mastoid is the sigmoid sinus, which curves downward and then sharply upward to pass medial to the facial nerve, becoming the dome of the jugular bulb in the middle ear space. The posterior belly of the digastric muscle forms a groove in the base of the mastoid bone. Contents of the tympanic cavity. The most important content of the middle ear is air, which flows into the middle ear through a patent eustachian tube. Other contents include 3 ossicles, malleus, incus, and stapes. 2 muscles, tensor tympani and stapedius. 2 nerves, chorda tympani and tympanic plexus. Ossicles. The ossicles form a semi-rigid bony chain for conducting sound, held in position by ligaments, muscles, and interossicular joints. Malleus. The largest ossicle, measuring up to 9 millimeters in length. Shaped like a hammer with a head, neck, and 3 processes, handle, lateral process, and anterior process. Head of the malleus lies in the attic, epitympanum. Divides the attic into anterior and posterior portions. Supported by the superior ligament, which runs upward to the tegmen tympani. Articulates with the body of the incus via a synovial joint. Neck of the malleus also lies in the attic. Below the neck, the bone broadens and gives rise to the handle, lateral process, and anterior process. Handle of the malleus, manubrium, runs downward, medially, and slightly backward between the mucosal and fibrous layers of the tympanic membrane. Its most prominent lower part is the umbo. Lateral process of the malleus forms a knob-like projection on the outer surface of the tympanic membrane. Gives attachment to the anterior and posterior malleolar folds from the tympanic annulus. Anterior process of the malleus. A slender anterior ligament arises from this process and inserts into the petrotympanic fissure. The chorda tympani nerve crosses the upper part of the malleus handle on its medial surface, above the insertion of the tendon of the tensor tympani, but below the neck of the malleus itself. Incus has a body and two processes, short process and long process. Shaped like an anvil. Body of the incus lies in the attic, suspended by the superior incutal ligament attached to the tegmen tympani. Articulates with the malleus via a synovial joint. Short process of the incus projects backward from the body and lies in the fossa incutus, attached by a short suspensory ligament. Long process of the incus hangs vertically and descends into the mesotympanum behind and medial to the handle of the malleus. At its tip, the lenticular process articulates with the head of the stapes. The long process has poor blood supply and is prone to necrosis in disease conditions, often being the first part eroded in cholesteatoma. Lenticular process of the incus, sometimes called the fourth ossicle due to its incomplete fusion with the tip of the long process, giving the appearance of a separate bone. Stapes, shaped like a stirrup with a head, neck, anterior and posterior crura, and a footplate. Head of the stapes points laterally and articulates with the lenticular process of the incus. Neck of the stapes. The stapedius tendon inserts into the posterior part of the neck and the upper portion of the posterior crus. Crura of the stapes. The neck gives rise to two crura. The posterior crus is longer and thicker than the anterior crus. Both crura join the footplate. Footplate of the stapes lies in the oval window attached to the bony margins by the annular ligament. Average dimensions 3 mm long and 1.4 mm wide. The long axis of the footplate is almost horizontal, with the posterior end slightly lower than the anterior. Intratympanic muscles. Two muscles are present in the middle ear, tensor tympani and stapedius. Tensor tympani muscle, a first arch muscle supplied by the medial pterygoid nerve, a branch of the mandibular nerve V3, arises from the walls of the bony canal above the eustachian tube and the greater wing of the sphenoid. Its tendon enters the processus cochleariformis, turns laterally, and inserts into the medial aspect of the upper end of the malleus handle. Functions to tense the tympanic membrane, aiding in sound perception. Stapedius muscle, a second arch muscle supplied by a branch of the facial nerve. The smallest muscle in the body, arises from the walls of the conical cavity within the pyramid. Its tendon inserts into the neck and posterior crus of the stapes. Functions to dampen excessive sound transmission into the inner ear, protecting against noise trauma. Patients with facial nerve palsy may experience hyperacusis due to the lack of stapedius muscle action. Tympanic plexus lies on the promontory, formed by tympanic branch of the glossopharyngeal nerve, Jacobson's nerve. Carotid-tympanic nerves, sympathetic fibers from the plexus around the internal carotid artery. Provides innervation to medial surface of the tympanic membrane. Mucous membrane lining the tympanic cavity, bony eustachian tube, mastoid antrum, and air cells. Secretomotor fibers to the parotid gland. Lesser petrosal nerve carries parasympathetic fibers from the glossopharyngeal nerve to the otic ganglion, which then supplies the parotid gland via the auriculotemporal nerve. Blood supply of the middle ear. The middle ear is supplied by 6 arteries from both the internal and external carotid systems. Anterior tympanic branch of the maxillary artery supplies the tympanic membrane. Posterior tympanic branch of the stylomastoid artery, branch of the posterior auricular artery, supplies the middle ear and mastoid air cells. Petrosal branch of the middle meningeal artery, superior tympanic branch of the middle meningeal artery, branch of the artery of the pterygoid canal, tympanic branch of the internal carotid artery. Veins drain into the pterygoid venous plexus and superior petrosal sinus. Lymphatic drainage is to the retropharyngeal and parotid nodes.